Well, welcome everyone to our second webinar to the Back to Basics training series. Today, we're going to do an assessment review. So for some folks on the call, this is a review. For some people, it could be the first time that you've been part of any training with us or the state in terms of the step one of SPIF, which is assessment, which we're going to go more into what that means and what that entails. So, yeah, so we can go to the next slide. That's you, Brooke. Back to slide.
My apologies. I thought there was like another slide. I thought this was just the title slide. Sorry. Okay. Good morning, everyone. Again, welcome and thank you for joining us for this second session of the Back to Basics call. Just within OPHI, for those of you who participate on OFR, you are aware that we have lost another one of our staff, which was Rachel Bequera, who served as an epidemiologist and supported a lot of work that we did around data analysis and things like that, and visualization. But she's moved on to a great opportunity, so we're happy for her, and we will be rehiring for that position. With regard to the prevention grants, we will be deploying those applications in January. We are preparing for a session in January where we will kind of go over that and go over some materials that the BERT team has created to help you all through the application process. It will, if you could, if you're on a phone line, you can just press *6, I believe, and you should be able to put yourself on mute. Um, and then I think you can do the same thing to come back off of mute when you need to. Thank you very much. And so what we'll do is, again, we'll have that session. That's going to be January 20th. That's when we'll talk about all things grant season, grant submission season, application season. We will, something that we're doing that's going to be new, and I did not even get back to the BERT team about this, but they were aware because we had been in discussions, is that we are going to move to a grant application submission um, on a biannual basis. So every two, or biennial, sorry, basis. So every 2 years, you will be submitting your grant applications. Of course, yearly, you'll still have to submit your uh, budgets and things like that. But at the what we're going to be doing again is moving so that we are not submitting applications every 2 years. One of the things that we have decided as we look at this is, think about it. You really kind of just got started with your year, right? And you're implementing, and you may not have the data that you need to be able to help inform kind of the new application. So the we're implementing it now so that in 20, what's going to happen is this application that you submit will go from July 2022 to June 2024. Uh, Please forgive me, you all. We unexpectedly have a little person in our home through the end of the year instead of at school. So if you hear any little noises in the background, that is who that is. Um, I think those are the major updates. That we're going to have a call on the 20th to kind of go over the application and all of the materials that we'll be providing you. The application is for 2 years, and you'll just submit a budget on the off years. So that's what you'll need to be thinking about. Your applications are to be due March 31st. So I want to let you know about that. And I think those are the major updates for now. If you have any questions, of course, you're always welcome to contact me. And so thank you to the BERT team. And I will let you all move on ahead with the rest of the session. Are there any questions right now before we move on? You can just raise your hand, or I don't see anything in the chat. Everyone's saying good
Hi, hi, Brooke. This is Jackie Hartman from Cecil County. How you doing?
morning. Well, how are you?
Pretty good. Just clarifying what you said. The budget. You said the app will be due on March 31st, and you said budgets submitted. You said on the off year. I thought you said budgets every year, but the app every 2 years.
Sorry. So let me clarify. Yes, your budget is
Okay.
submitted every single year, but the only thing submitted in the off year outside of when the application is not, is just your budget, is what I meant. So you're only
Okay.
submitting your budget on the off year, but it's
Gotcha.
submitted every single year.
Okay. Thanks.
Okay. Hopefully that clarifies. Were there any other questions? If not, all right. Take it away, Bert.
Thank you. All right, next slide. All right, so welcome everyone. So this presentation is being put on by the Behavioral Health Resources and Technical Assistance Program. Just a reminder that our team is out of the University of Maryland School of Pharmacy, and we help provide technical assistance to help guide the communities across Maryland in addressing substance use prevention issues. Our mission is to improve public health by bridging the gap between research and practice through technical assistance and evaluation. We do have a few quick announcements we wanted to share with you. Sharday Jones is on maternity leave, but then also is leaving our team. We'll provide more. So at the end of the slides, we have an update that Vanessa will be taking over the central region jurisdictions for TA needs. And then we have one exciting announcement that Paris Barnes, who is on the call, is our new communications program specialist. And so she will be helping us with providing any technical assistance when it comes to communication and dissemination, as well as helping on our end with providing dissemination products. Before we get started, Brooke kind of talked about making sure that you're muted. So as a reminder to just mute. And as we go forward, if you have any questions, you can raise your hand and also just ask questions in the chat, and we'll be monitoring that to then respond throughout. So we're going to jump to the next slide. So today's learning objectives are to be able to define what is assessment, the step one of the strategic prevention framework, identify what components go into a needs assessment, to be able to describe the core data areas of the assessment phase and which data to collect, and also to understand how to develop data collection tools and collect your own primary data. All right, next slide. All right, so Brooke, can you launch the poll? Before we get started, I just wanted to gauge everyone's where you all are when it comes to assessment.
Is everybody seeing it? If not, there is a little icon. Okay, I see some votes coming in. In the bottom right with the triangle, square, and circle. If you click on that, you should be able to see polls and just see what's been launched. So we have 54 folks in here, taking away the BERT team. I think that leaves us at what, like 48, well, myself included. So that leaves us about 45, 46 folks that we're looking to be responding to this poll. Looking good, it's looking good. Okay, looks like we've got just a few more seconds. Okay, I've ended the poll.
Awesome. All right, so we see a mix of some, like we are expecting of, okay, Lynn, if you wanted to just put in the chat, or anyone else that doesn't have access to polls, you, if you wanted to just respond in the chat, that'd be great. But this is what, we're expecting. Like I said, this is a refresher for some, and as well as sort of like newer material for others. So hopefully, even if you are comfortable, you'll learn some new tips and new data to collect when it comes to assessment. So, okay, so next slide. So just to review that the SPIF as well as a needs assessment is a data-driven process. And so by definition, a needs assessment is a systematic gather and analysis of data about the community your coalition or health department serves for the purpose of identifying and addressing local problems related to a particular substance. The needs assessment phase is considered one of the most important components of the SPIF process as it lays the foundation moving forward. So within assessment, we're able to assess the problems and the related behaviors, prioritize those problems, and then assess the risk and protective factors related to those problems. Next slide. So everyone remembers our good little SPIF wheel flower. And so assessment lays the foundation for prevention efforts. But also the needs assessment is an ongoing process. No needs assessment is ever complete. So that's one thing that I think we just wanted to really highlight, that, most of us went through and did a formal needs assessment, but assessment itself is always ongoing. We want to always be looking and finding where there's additional data and need, and always reassessing what's happening in our community. Conducting a needs assessment is the foundation, but like I said, ongoing data collection is key. It's important to identify data gaps and collect data from data sources for the key data indicators to be able to update the assessment in your jurisdiction. So what goes into this needs assessment? Data collection. So we have our qualitative and quantitative data, and we'll go into more specific examples of that later. The analysis of that data. So asking questions about the data and how it's impacting your community. And the assessment of capacity, to really be able to see your community resources and community readiness to really know what you're able to address within your jurisdiction. Next slide. So the overall goal of a needs assessment is to answer the following sort of W questions: the what, the who, the where, the why, the when, right? So what substance misuse problems and related harmful behaviors are occurring in your community? How often are these problems and harmful behaviors recurring? Which ones are happening the most? Where are these substances misuse problems and related harmful behaviors occurring? For example, at the home or in small groups, big parties. Who is experiencing more of these problems and the related behaviors? To really drill down to those target populations, right? Looking at data to really assess who is being most impacted. And then lastly, why are these problems occurring? So what factors are associated with the substance misuse problems and the related harmful behaviors? So our risk and protective factors. Next slide. So the first step is really identifying the problem. And the criteria to prioritize problems and related harmful behaviors include magnitude, severity, trend, and changeability. And so the what, that problem, really assesses the magnitude of different substances in your community using consumption and consequence data. And questions that you always want to consider when sort of looking at the data that you've collected is, how does your county's rate compare to the rest of the state? Are the trends increasing, decreasing? Are they flat? Are they varying from year to year? How would you rate the magnitude of each substance use in your county? By looking at the prevalence, the trends, as well as compared to the state. Would you say it's high, moderate, or low? As well as looking at how would you rate the severity of specific consequences due to the harmful due to harmful behaviors, sort of ranking them high, moderate, or low. So that step of collecting the data, but then also sort of analyzing the data to really be able to assess how big of an impact that specific substance as well as the related problems are having in your community. Next slide. The next component is sort of looking at your root causes. What are the underlying factors that are contributing to those substance use behaviors and related problems? As a quick reminder, risk factors are the factors associated with a higher likelihood of developing a problem, and the protective factors are factors associated with a lower likelihood of developing a problem. So one of the things that we always want to emphasize is really letting the data drive the decisions, right? So especially when we're looking at our underlying factors, the sort of that why, the factors that are driving substance use and misuse, and really looking at those problems and assessing which of these specific factors are most likely to contribute to the misuse and the related consequences versus knowing thinking too far ahead into prevention planning and what you think you should be addressing, but really let the data tell you the magnitude and severity. Another tip is to remember that the social ecological model that we went over during the last training, and that risk and protective factors are found on all levels of the social ecological model. So you have the individual factors that impact the relationship level factors, community level factors, as well as societal level factors. Additionally, risk and protective factors exist in multiple contexts. They also are correlated and cumulative. Risk and protective factors are influenced over time, and not all people or populations are at the same risk. So next slide. So when conducting a needs assessment, there are 6 key data areas to really collect data in order to assess your community and build the foundation for a successful prevention plan. So our core data areas are consumption patterns, and really looking at the data that will help you analyze that, consequences, target population data, data around intervening variables, so our risk and protective factors, the root causes, those main drivers that we really will focus on in our planning, prevention resources, and community readiness. So, next slide.
So, whenever we are conducting a needs assessment in the community, we have to ensure that we are collecting the right data. Next slide. Oh, sorry. So, whenever we are conducting a needs assessment in the community, we have to ensure that we are collecting the right data. Next slide, please. Consumption patterns describe substance use behaviors in terms of frequency or amount used. Collecting consumption data helps understand the magnitude or the problem in terms of the number of people affected. Examples of data indicators are the types of substance used, such as alcohol, marijuana, prescription opioids, illicit drugs, frequency of use or how often a substance is consumed. For example, was it during the past 30 days, lifetime use, or daily use? Quantity consumed, for example, number of drinks consumed in a certain time frame. Method used for consuming substances such as smoking, vaping, edibles, or injecting it. Age of initiation. Timing of use. Is it during the holidays or other special events? And consumption use data indicators can be found at the following data sources: BRBS, NISDA, MPOS, MISA Core Alcohol and Drug Survey, the Maryland College Alcohol Survey, hospital data, NDH, and the CRIS data dashboard. Next slide. Consequence data help describe the impact or depth of the substance use problem in your community. Consequences of substance use can include social, economic, or health problems. Academic consequence data indicators can include academic performance, graduation records, truancy, and dropout rates. And you can find these data indicators from local school districts and the State Department of Education. Health consequence data indicators can include teen pregnancy, risky sexual behaviors, liver disease, cancer, overdose deaths, and other chronic health problems. And these data sources can be found from the census, local healthcare systems, CDC, overdose data dashboard, and CDC Wonder. Crime consequence data indicators can include car accidents, property damage, domestic violence, university or college crimes, DUI or DWI, sexual assaults, and the data sources for crime consequences can be found at your local health law enforcement office, first responder data call log, the National Highway Traffic Safety Administration state data system reports, Bureau of Justice, and university crime reports. Additional consequence data indicators you could use include unemployment, homelessness, and divorces. And these can be found from your from your state employment and labor department, county health rankings and roadmaps, the U.S. Department of Housing and Urban Development, the U.S. Department of Education, and the Census and County Government. Next slide, please. You can use data to identify the groups of individuals that are experiencing substance use and those that are affected by individuals that are using substances. Data indicators to consider are age, gender, sexual orientation, race or ethnicity, military or veteran status, urban or rural, if they live in an urban or rural area, their disability status, and educational attainment. You can find these data indicators using sources such as census, survey data, YRBS, Breakfast, NISA, the local military office, MDH, and your local health department. Next slide, please. So intervening variables are factors that can increase, which is considered a risk factor, or decrease, a protective factor, a person's chance of substance use. So now it's time for you to tell us any risk or protective factors that you have identified in your community. And I will provide a link in the chat so you can give us your answers. And Paris, can you stop sharing your screen, please? Um, can you see my screen?
Yes.
Okay. So please share any risk or protective factors that you have identified in your community. And there should also be a link in the chat as well.
Thank you, Hillary. Vanessa, I had written in the chat that for those who may be new to this, that it may be helpful to let them know what the acronyms are that you have been saying throughout your portion, and even Nicole, whoever, just make sure that you spell those out.
Okay, thank you. So I see some people have written substance use, social, community, the perception, community norms, access, poverty, isolation. Okay.
Hey Vanessa,
Yes.
this is Ben. I typed in a couple items, but it seems like they are kind of distorted or separated. So it's like I typed in social access, low perception of harm, um,
I see.
norms favorable to substance use and things like that. So it's, I don't know. It seems like this is
It's doing the work,
distorting.
yeah. Vanessa,
Yeah.
you can switch it so instead of word cloud, you can display the responses as just whole, I think.
Hold on. I I don't know how to do that.
It's when you were showing it, you can just how you response settings on the side there. Other side, the right side, yeah. Um,
Yeah, I don't.
okay, don't. It's okay.
Okay.
We'll pull it out, but that's
Okay.
okay.
Thank you. So Percy, I will stop sharing. We can go back to the PowerPoint. You can. Okay. Click on the next. So these are shared risk factors for suicide, ACEs, and overdose prevention. As you can see, there's many of them. So there's pure substance use, high availability of substances, low neighborhood attachment, low school completion rates, and high rates of unemployment or underemployment. Next. And now we have protective factors for suicide, ACEs, and overdose prevention, which include social, emotional, behavioral, cognitive, and moral competence, spirituality, resilience, and bonding. And the data sources for intervening variables are youth surveys, focus groups, key informant interviews, census data, school level data, labor statistic data, and community and environmental scans. Next slide.
Can you go back real quick,
Oh,
Vanessa? I just want to make a comment. Sure. Um, these are not the shared risk and protective factors. That was just to as a note, but we just wanted to highlight. I don't know if you guys just to take note of some of the additional risk factors and some of the protective factors that maybe you haven't identified before in your community. These are obviously not an exhaustive list of the risk factors. We try to include some that haven't been really identified in previous assessments. So by looking at some of this risk factor list, are there any examples that you see that you haven't maybe found data from before, but you would think that that might be an area that might be impactful or impacted in substance use and the related harms in your jurisdiction? Especially from what we saw with some of the results, a lot of people, pointing to a lot of the access and norms and attitudes. So are there any of these other type of risk factors or even protective factors that you think that you might want to investigate and assess in your jurisdiction? Anybody? Just something to think about. Definitely to look at this list moving forward then. So thanks.
assessing community resources. Most communities already do some sort of substance use prevention. Therefore, it is important to consider resources already being used. A resource assessment will help you identify potential resource gaps, build support for prevention activities, and ensure a realistic match between identified needs and available resources. When people hear the word resource, they often think of staff, financial support, and a sound organizational structure. However, resources may also include the following: existing community efforts to address the prevention and reduction of substance use, community awareness of those efforts, specialized knowledge of prevention research, theory, and practice, practical experience working with particular populations, and knowledge of the ways that local politics and policies help or hinder prevention efforts. You can collect this data by conducting a landscape assessment or community mapping of prevention efforts and resources at your local health department, the overdose intervention team, or OIT, harm reduction, and other community organizations. Next slide. Community readiness helps determine if a community is ready to accept that a substance misuse problem exists and to take action to address the problem. The dimensions of community readiness include community knowledge of efforts. How much does the community know about the current programs or activities? Leadership. What is leadership's attitudes toward addressing the issue? Community climate. What is the community's attitude toward addressing the issue? Community knowledge of the issue. How much does the community know about the issue? And resources. What are the resources that are being used or could be used to address the issue? Bert will share examples of community readiness surveys and interviews in our toolkit. Next slide. It's break time. We will see you in 10 minutes and enjoy some holiday tunes.
Hello, can you hear me? All right. Welcome back, everyone. Um, hope that break was good for you to get up, stretch, and move around a little bit. Um, we're moving into the next section now that we are going to talk about how to identify data sources and leverage other community assessments. So, earlier in the discussion, we discussed examples of data sources for each core data area. And after assessing the data, you really have to know where the gaps are, right, for your indicators. And you also need to identify data sources, community partners. And those who have conducted community assessments know that you got to fill those gaps in areas where you need to collect that qualitative and quantitative data. I think you can go to the next slide, please. So we have a couple of questions here for you, and we're going to go into breakout rooms for approximately about 15 minutes. Once you get into that breakout room, you should uh, decide who is going to maybe take notes on what's discussed, and then choose a person to report out when we come back from the breakout. But in the breakout, you're going to be answering these 4 questions, and make sure that you are on mute. You'll be answering these 4 questions. What data do you have access to? What data sources have you utilized in your current assessment efforts? Are there barriers to finding data sources for data indicators? And discuss how you leveraged other community assessments. So I think Brooke is going to put us into the breakouts, and then I guess we probably should maybe put these questions in the chat so that everyone has them, or whoever's in your room that may be able to help facilitate the actual questions. So we'll see you back here in about 15 minutes.
Does, for you all who are still in this main room, do you see an option at the bottom? It should be on your, well, one, it should be on your screen asking you to join the room. And then if not, clicking on that triangle, square, and circle to find breakout rooms. Let me see if I can do. You're moving slowly but surely. You're all assigned to a breakout room. You just need to move to it. Shelly, for some reason it's saying that you can't be assigned to a room, and I'm not sure, so let me check that out.
Should I try joining again?
So Kathy, I just put you in room 1. See if that will work. Do you see anything on your screen? Shelley, I'm not sure how you joined. It's telling me that you cannot be assigned. And I could not figure out where to assign you. It still should allow you to join a room. That shouldn't hinder you. Right here. Give me that. Thank you. Oh, I thought she was giving them to me. You want them? No. She brought them up here.
Sorry about that, Ben. You were cut off right in
That's okay. It's all right.
10 minutes. But we thank you for answering that last question for us. We appreciate it. Um, I don't know if for my group, if Latiqua, if you could share maybe your notes with Mindy, just to make sure I know Mindy was trying to take notes also, but she was going to report out for our group. If you wouldn't mind just sharing your notes with her also, please.
Okay, Dr. I thought Carol was taking notes.
Oh,
Albert.
I'm sorry. You are correct.
That's okay.
I apologize, Carol.
I took the notes, but I wrote them on a pad on a
Oh,
note.
you did. Okay. Well, I
Yeah,
guess maybe
sorry, was I supposed to write them somewhere else?
it's okay. I just want you didn't have to write them anywhere else, but I guess maybe if you could support Mindy, please.
I will do the note taking. If she leaves
Because
anything out, I'll add to it.
okay, thank you so much. I appreciate
You're
it.
welcome.
Look, and I don't even know if we were group number 1, but we're going first. So So go ahead, Mindy, when you're ready. And I'm going to mute myself so we don't get
All
feedback.
right. All right. So the first question talked about data that we have access to. And we mentioned all the surveys that were mentioned earlier in this webinar, the YRBS, MPOS, MISA, also using focus groups, hospital data, law enforcement data, and from fire and rescue for opioid deaths and overdose. OFRT for Narcan usage, school climate surveys, DFC surveys, and the CRISP system, which I believe is a hospital system. Am I correct?
The CRISP data dashboard, the CRISP is like what the hospitals have, but then they also are like the underlying. So the data dashboard actually has access where you can get the PDMP data, hospital data, as well as overdose dashboard data. Yeah.
It sounds like a really comprehensive system to refer to.
Yeah, and they actually also now have a naloxone dashboard as well, part of that. So
good to know. Then we talked about what data collection services or what surveys we actually use. One comment, and it was really just the things that we listed are the things that we use. There was nothing new that was added to that. But with the comment that a lot of the surveys collect the same information with different results. And that's where CRISP was noted as being very complete and accurate compared to other surveys. My personal opinion on that is that when you can find things that are local, that makes it more relevant to you. So I'll just add that since I'm the one talking. For barriers, we talked about the barrier of accessing youth when they need often parental permissions, and the school is often a difficult entity to break through to get information pertaining to youth. The timeliness of surveys, that often our data is always a little bit behind. The need for incentives. Someone mentioned that when incentives are offered, such as pens or little trinkets, that they're just not good enough. What is wanted is money and gift cards. Also COVID as a barrier. I think that was mentioned in the context of accessing youth, again, getting to schools and not having schools in session the way that they were in surveys, administered in the way that they were prior to COVID. And then survey fatigue for college students. And there were also some suggestions made about tagging on to another activity, such as sport. I think cross country was mentioned, or to tag on to another training, as I guess to combat that fatigue, or in place of an incentive, just something else to do. And we got to the question on leveraging other community assessments, and somebody was speaking, but I got cut off. I also sneezed and lost my connection for about 30 seconds. So
I wonder if, Ben, would you mind sharing what you talked about for the example? Still there, Ben? I can't tell. Brooke, can you tell if Ben's still on? Oh,
I'm
there he
here.
is.
I apologize.
It's okay.
What did I'm sorry. I had to step away for a second.
That's okay, sir. I was just asking if you wouldn't mind answering the last
The
question
last
for a
question.
group.
Oh, okay.
Yeah, only because we
Sure.
got cut off
Because
and
I
then you
got
couldn't
cut
hear
off
you.
exactly.
Yes.
The Google meeting was being rude to me. It's okay.
Okay.
I would just say that in our community, on our prevention team, we've been able to build a partnership with our school system in regards of being able to get access to school system data as far as like the school climate survey, as well as information about kids who might violate substance use policy within the school. So they don't give us specific names or anything like that, but we're just getting like the ideas of like substance violations or paraphernalia violations, as well as information about zip codes. They try to leave the actual school names out and stuff like that, so that information has been pretty helpful. And I think being able to foster that partnership, because we haven't been able to actually get into schools like we normally do, just to have interactions with the young people directly has been helpful.
Great. Thank you so much, Ben. We appreciate that. And just a quick thanks to Mindy, Carol, and all of those that participate. We needed like 30 minutes in our group to finish up the questions, but I really appreciate all your participation. And now let's go ahead and hear from is there just one other group or is there two?
It was one other group.
Okay, so if we can go ahead and hear from the second group.
Oh, okay. Yeah, so I know that Paris took notes for our group.
I did. So a lot of the information or the gatherings that we received was pretty comprehensive and just about the same as the group that presented ahead of us. So a lot of people shared that they received some data from their local sheriff's office or police departments. They use other data sources, same as everyone else. They use MISA reports, just pretty much just about the same across the board. I want to kind of jump to barriers because some of the barriers discussed were very relevant, and it seems like everyone's kind of having the same barrier. So some of the barriers discussed were trying to get up-to-date information. So some of the information that we have may not be the most up-to-date. It might take a little bit to actually have a report that makes sense. So that's certainly a barrier when the data that you have may be a couple months or years out of date. Another issue or barrier was children. Someone mentioned that they were doing some studies and some research on the use of marijuana and trying to get some information from the police department for maybe those younger first-time offenders. And of course, because they can't release the information, it's kind of hard to get that data on younger people. So that's a big barrier as well, just receiving any information or data or anything they can for individuals who are children or students, should I say. Let's see what else we have. Another barrier as well has just been COVID-19. And I think that's a barrier across the board for just about everybody and everything. So with the way things are and ever changing, it's just been very difficult to receive data and information in regards to COVID-19. And then one more that's a little bit different is, I want to say this young lady was from Harford County. She indicated that sometimes the data isn't as comprehensive as they would like. So sometimes the sheriff's office provides data a little bit less on heroin use or misuse, but more on fentanyl use or misuse. So it seems like they want just a little bit of everything, and they're only getting some small segmentations of those things. And I think that is all. Did I miss anything, Nicole, or anybody from my team?
No, I think one thing is just we are kind of discussing some of those other types of data. I think trying and we'll be able to share some of those lists of moving beyond some of our, like everyone identified some of those surveys, but really reaching out to some of like really looking in deeper into census and other partners on data that they collect, maybe around homelessness or some of these other factors that people might have not collected data around before, and that they really can really help identify who's being impacted by different substances, and can also identify where you should be targeted. And another thing just to mention is that, surveys are only one source, but then, and people in our group also mentioned doing, collecting some of that qualitative data. So key informants, interviews, and focus groups. And that that's just as a reminder to really help fill in some of those gaps with the data. So you might have a survey that you might feel is broader, maybe it's a couple years older, but that's where you can then, reach out and try and dig a little deeper. And surveys are only going to ask certain questions, but then the qualitative data allows you to kind of go to that next level. And you want to sort of pull all your different data sources to get that full picture. So I think that, and I think we talked about also in terms of other, looking at all the local hospitals do community needs assessments. Those are required. So just reaching out and working with your hospitals as well as other agencies that maybe are doing assessments, maybe for grants, like just really identifying those partners within the health department and within your jurisdiction who maybe have done a needs assessment in the last 3 years, and how can you, utilize those reports rather than, and the hospitals are conducted every 3 years. So they should be a good resource if you haven't looked into those before. So back to you, Michelle.
Okay, well, thank you all again for great discussion and highlights to answer these questions. You can go ahead and advance, Paris. Okay, so when we know that we have to bring up health equity, right? And you should know and remember that health equity is achieved when all people can attain their highest level of health. It is when differences in health outcomes between groups of people are eliminated that we really have to make sure that we put our attention on this. So we have to remember that we have to incorporate the health equity lens when we are conducting our needs assessment. To be effective in this, you should work to really advance health equity, not only considering how you are working with the community residents, but also how your internal policies, practices, and priorities really support or hinder the work that you want to do. You should remember that within an organization, you should have language that's shared, an understanding of those gaps and opportunities to develop your capacity to advance health equity. If you think about it, most doctors, when they're assessing the health needs of an individual patient, good doctors, right, through professional training and clinical experience, they've developed this sort of systematic approach to assessment. And we should use this not only in that treatment side, but it's also very much effective in having that thought process in how we conduct this assessment and pulling out and distinguishing what are those individual needs for our community. You want to remember and think about, even before we get to what it includes, that health needs assessments and when you're doing these assessments, that systematic approach really helps to ensure that your health services and the things you're providing are good resources that are effective and efficient for your community. Again, remembering what Nicole just talked about, that qualitative, quantitative, and different methods of describing and pulling out those issues for your population is important for you to be able to identify specifically what you can do to help address those needs. Successful assessments really require that practical understanding of what's involved, the time, the resources, and who in particular we are targeting. And so, really, in public health, the field used to really focus on those individual behaviors like nutrition, exercise, right, tobacco, as those key determinants of health. But we really are now um, progressing into recognizing that where we live, where we learn, where we work, and play really impacts our health overall. Um, and so there's growing evidence with equal access to clean air, healthy food, good schools, right, safe communities, that really have an impact on health outcomes within a community. So the shift really has brought more attention and energy to the goal of health equity. Health equity is concerned with creating a better opportunity for health and giving special attention to the needs of those at greatest risk for that poor health. So, when we approach this, what does it look like? How do we put this health equity lens on here? Um, when you're conducting that needs assessment, you have to assess the data and prioritize the community itself. It's essential that you use that qualitative, quantitative data to paint that complete picture of what's going on in your community and prioritize your community's voice. Um, those people that are within the community, they know exactly what they need, right? So you have to be able to pull on that and engage your stakeholders to make sure that they understand what those priorities are. Meeting people where they are, right? People with the greatest health risk are often the hardest time to engage. So it's meaningful for you to understand what's going on in those low income communities or communities of color in the data collection process. Who are you talking to? Are you representing everyone that's in your community, but also identifying those that are at the greatest need? And then you're going to examine the indicators. And so you're pushing beyond maybe your immediate county level and indicators of disparities or vulnerable groups, but you're also, looking at other comparisons. Maybe it's you examining specifics of zip codes or race and ethnicity or age and gender or income to really shed an important light on where exactly and who exactly those disparities exist with. And then last but not least, really starting the conversation. So starting the conversation with whoever it needs to be with. Maybe it is local leaders. Maybe it is those individuals that can help you to really achieve what the goals of the assessment and outcomes are. Um, Remember that a needs assessment with a health equity lens provides you an opportunity to describe the patterns and the issues of the local population and the differences, either regionally or even on a national level. You learn more about needs and priorities of the local population. You're able to highlight areas of unmet need and provide a clear onset of objectives to work towards those needs. You're deciding rationally how to use your resources and improve the health of those that you're serving. And you're influencing policy, integrating collaboration and research to really develop your priorities. So it's important for us to make sure that we include and are inclusive with this health equity lens when we're doing the assessment. Go ahead, Paris. Okay, I'm going to send it back to Nicole for developing tools for assessment. You're on mute, Nicole.
Thank you.
You're welcome.
So now developing tools. We can go to the next slide. So in our discussion and as well previously, a lot of the data sources we discussed were sort of secondary data sources that exist. So, our YRBS, our NISDA surveys that are, conducted through, and then we're able to have access to that data. And then the law enforcement, hospital data, all of those types of data sources are accessible. But then when we're trying to identify those gaps and see what other needs we have, there is a need to maybe develop our own surveys to maybe further drill down and maybe ask some specific questions, and to be able to reach other populations that maybe those broader surveys didn't reach, as well as qualitative data. So like I said, after assessing your data gaps, you may need to collect your own assessment data. So conducting focus groups and key informant interviews will help you gain a deeper understanding of the substance use and related harms in your community by obtaining insight into the beliefs, attitudes, and policies and practices of various stakeholders. In addition to focus groups and key informant interviews, other qualitative data sources could be town halls or like community conversations. So like reaching out to like a larger group rather to using similar setup as a focus group, but more people there. And as well as photo voice, that's a way where you allow usually a youth, but different stakeholders to kind of represent the needs of their community through photo. And then they can share their sort of that's where you get a lot of that lived experience or sort of personal experience of like their community and sort of how it's impacted them through photos, which really can tell you a lot, and then follow up with sort of focus groups as well. Some tips on developing surveys and interview guides, and I know a lot of you have developed your own surveys, but it might help with surveys, is if there are a lot of these established surveys. So really starting first with maybe pulling questions that have been tested and utilized in those national or other local surveys, right, to make sure that they're strong and relevant and really capturing the data needed. In terms of interview questions, you want to make sure that they're clear, honest, stimulating, and appropriate. And some of the other, key tips is really making sure you have open-ending questions. They're not really leading. And you want to go into it sort of not letting the discussion sort of guide your responses versus sort of having too many really driven questions. You want them to be able to be open-ended with some probes, but really let the discussion guide what people are sharing. And that's really important, really to get into those deeper root causes and those gaps that you've all have identified when it comes to some of the data sources that exist, especially if you're talking about timeliness. The focus groups or interviews can allow you to sort of gather data to fill in some of those timeliness gaps. Next slide. So how can we collect data from our community and our target populations? We know that a lot of you mentioned how hard it is to reach youth and obviously access and youth through schools, but what are some other ways that we can reach youth as well as other people in our community, all the different stakeholders? So obviously one option is utilizing online survey platforms so that it's moving to allow people to take surveys on any of their devices. QR codes is a great way to sort of disseminate those surveys as well, or even like your recruitment for focus groups. So any of your flyers, your messaging, to really have that QR code, so it's really easy for people to access it. It's not even hitting a link, they just go straight there. That has been shown to be very helpful. Recruitment via social media, so all the different forms so that and you can then do your targeted recruitment to really reach out and get who you need to find information from. And then I think a really important one is recruitment utilizing your community partners. So how if we can't reach youth through schools or youth and young adults, what are some other community partners that have access? So, moving beyond school. So I think someone had mentioned sports. So like working with Parks and Rec, are there after school programs? Are there other groups that have access to youth that they could disseminate, that information to listservs? so that you can access that population, but not via the school. So that's just some ideas, but obviously the community partners is really key. So the more identified partners that you have, that really will help you to sort of build that yes, very true. Les mentioned about online surveys. You want to make sure that you do have some security measures in place and really make sure you have different checks of zip code, as well as there's some other tests of making sure that people are who they are, who you want to be reaching when you're doing the online survey. So making sure all those security measures are in place to have verification of who's completing the surveys. And you might have to clean your data, unfortunately. That's some of the risks, right, with that. But we wanted to just jump now into some discussion and really about primary data collection as well as recruitment tips. We'll just open this up to the group next slide, sorry, Paris. To really have that discussion of those jurisdictions that are working on developing their own primary data tools, those that currently are implemented or have in the past, how you've collected that, like what are the different methods you've used, and then as well as the recruitment tips or any recruitment tips that you are that you can share with the group. How have you been able to reach different populations in your community? I know we've talked about youth, but what about some of those other stakeholders, or like Michelle was saying, those that are most impacted? Have you been able to reach the maybe people who use drugs or people in recovery, or those that are impacted maybe that have just think about those different levels of the population, the different sectors maybe of youth. So maybe you've had more general youth, but have you been able to break down those that are more likely to have a substance use problem, and so that you can reach those to really assess for the needs of those populations that we really want to target. Mary Ellen, did you want to share? You come off mute.
Can you hear me, Nicole?
Yeah.
Okay. So sorry, I'm on the phone and the computer because I'm having speaker issues. But so we've been fortunate enough to be part of a senior fair that's occurs every year at our local senior center, and have been consistent in gathering data from that population, especially related to our smart medicine campaign and medicines collection, storage, safe storage, that sort of thing. So yeah, I think that was helpful in getting, an idea of how, if seniors actually know where to drop off medications, dispose of them safely, do they lock them up, do they know where they're located? So obviously last year we weren't able to do that, but they did resume it this year. So we participated again this year. And that helps give great feedback as to the effectiveness of our media campaign related to that particular item.
Great, thank you. Anyone else? I might call on people because I know there are some different jurisdictions that have collected data, at least recently. But Charlene, go for it.
Hi, can you hear me?
Yep.
Okay. To collect data for parents, we've set up at the Parks and Rec games, so like Little League sports, in order to gauge parents and get them to complete surveys. And we've also done the same at high school events. Parents always show up for their children. So if you have any activities going on where youth are going to be included, that's always a good opportunity to be able to collect data from them. We also have gone to our library. We've set up at our library, obviously other community events like health fairs. And we've gone to some of our senior centers to get some information as well.
Great. Anyone else who's been able to do maybe focus groups or key informant interviews to really reach those different subpopulations or stakeholders? Pat?
Yes, kind of piggybacking on what Charlene said, we've been using our Merlin Park and Planning. This year, normally they used to do Kinderfest, which used to bring tons of parents and youth. So they basically this year broke it down into different jurisdictions, which was even better for us to be able to reach more and more families in different jurisdictions where we would only be in one place. We were all over the county. But I just wanted to share this other thing that we're looking at, because we did one survey using the QR code, and we noticed that the families really like that. And I was in a meeting with some people for mental health, and they were doing just a survey. And what they did was they put a poster with the QR codes in all of their high school bathrooms. So I'm kind of piggyback on that idea to see how we can incorporate that with not only this initiative, maybe in other places like faith-based facilities and stuff. But I think this is a good resource to try to tap into. And I think somebody asked for you all to give us some more information about QR codes. So that's like a great resource.
Great, thanks, Pat. Yeah, the QR codes are definitely very helpful, and posters, any types of information that you can include that is a way that you can definitely reach people.
So,
Linda,
Nicole,
go ahead.
I would just like to add a really good place that we find to do a focus group, and it's is at the local On Our Own, and I know they're all over Maryland. And we are really hitting those at-risk populations. So it's really good for our OMPP grant. And it's just, like I said, a wealth of information. And we really find out what's going on also, on the streets, because you have people that are newly in recovery, dual diagnosis, homeless population, but you also have, it's just it's a mixture. And we found that has always been really beneficial. We just conducted one there last week, actually. So just a suggestion.
Great, thank you. I'll real quickly read a few comments, and then if anyone else wants to raise their hand. But so Hillary just shared that SurveyMonkey makes it easy to make QR codes, and I know Qualtrics as well that we utilize has that you can add a QR code. I don't know if you all noticed, but if you've been on Google Chrome, you can make any website in a QR code. It has the little QR icon in the whatever the line is, the thing where the top part of it.
Nicole, maybe you want to share, as you're sharing that suggestion, you want to share your screen so that they know what you're talking about? Yeah. If you can.
Yeah, and I'll do that. And then I'll quickly just read, Lynn was mentioning that they conducted focus groups with their middle school and high school students at Peer Leadership. They've sent surveys via SurveyMonkey to Salisbury students and sent them incentives. And they've added QR codes for their virtual Narcan training to their RAT card. So yeah, any types of, that's anything that you hand out, that's a good way to add QR codes for people to then access any types of surveys that you want to collect data that will help with assessing the needs of your community. Let me see if I can pull up something to show what that looks like. Need to find like a... But is anyone else, while I'm pulling that, to share? I'd love to hear. Is anyone from Washington County or Allegheny County? I know they've been collecting some local data recently. I know Anne Arundel, you guys are planning, but I'd love to hear if you wanted to share some of your plans for recruitment and collection. I know we've been working on development. Kathy, I see you. Can you? There you go.
Nicole, this is Kathy Powell.
I work with Allegheny County on their needs assessment, and we've relied mostly on key informant interviews as well as focus groups with key informants. And the reason we've gone that route is because the health department has strong relationships with partner agencies across the county. And so we've built on those relationships and asked people to participate in focus groups and key informant interviews with us. We haven't reached out to the general population, primarily because of COVID restrictions and just the difficulty in reaching people because, you know, community events have been curtailed of late. So we've relied heavily on organizational representatives in our needs assessment in Allegheny County.
Paris.
I just wanted to note, I'm not sure if any of you all are members of your local health improvement coalitions or your community service councils. Those are always amazing places with other local entities or nonprofit organizations that are already collecting data that you can kind of share resources with. So I know I was on the local health improvement coalition at Carroll County, and a young lady named Maggie Church has information on everything. So there was always ways to kind of hone in and figure out some additional resources and, you know, different ways to get to different places or even the right person because she knew everyone. So if you aren't a part of those boards, maybe look into them and try to attend the virtual meetings so you can try to hone in and get some information. I saw your comment. Good to see. It's always good to know.
I don't want to call anyone, but Mindy, I know that you guys are planning to do sort of a different approach. Would you be willing to share sort of what you guys are planning in Anne Arundel to try for collecting primary data and your sort of plan of reaching different pockets of the county?
Sure. Sorry, there's a little bit of background noise here a minute ago. So I didn't hear everything that was just said, but in terms of what we're planning, we have a survey that is going out digitally, and we're going to be conducting listening sessions throughout the county. And we are tasking our local prevention coalitions with organizing those locations that to reach all the little pockets of the community for the listening sessions. That's the overview of what we're doing. Does that answer your question?
Yeah. And maybe you could share like some of the different types of partners that you can try and reach those, you know, so that you're going to try and get all different representatives of the community, hopefully.
Right. So the coalitions are focused on the 12 sectors. So finding those locations. I'm sorry, I'm losing my voice a little bit.
That's okay. That's fine. I just know that you guys definitely. I saw that you have that plan to kind of like outreach to different, like you said, the different pockets, which I think is helpful, so that
the different different pockets, and I feel Anne Arundel County is a very diverse county. So just by stretching to the different coalitions, we reach completely different populations in the southern part of the county, which is very rural compared to Annapolis City, and compared to the the western county where the Army base is, and then the suburban pockets as well. And We have, I mean, geographically, like in my head, I know that all these little spots that we need to get to reach a really good sampling.
Mm-hmm.
I don't really know how to put that in words when I'm on the spot.
No, that's great. Has anyone done, I know like in the past people did community readiness. Has anyone done one recently or planning to do the community readiness like interviews again to sort of collect that sort of primary data, or done some community scans to really be able to see, assess the different levels of resources and activities to really identify gaps and overlaps, so that in terms of targeting which risk factors are being addressed? Anyone that started to do that or is in planning to kind of do some of those types of data collection in their process for that? Something to think about if you are not planning that. Anyone else like to share about any tips they want to share with their peers when it comes to collecting data or recruitment, how to reach different populations that you think might be helpful? This is your time to give some tips to everyone else.
This is Charlotte in Baltimore County. We haven't done it yet, but I'm just going to share with the group in case anyone might want to consider it, is we found that we were going to the same fishing pools to fish. So we have been talking with our evaluators, and they were able to identify a market company that specializes in finding contact information for people by zip code, and they can actually reach out to them through their phones or their web addresses. I don't know all the details yet because this is also brand new. So I'm really excited that we're going to be actually reaching new audiences, and we'll wait and see what the results will be. And what I mean by repetitive phishing is we go to Facebook and we go to Nextdoor, and sometimes we use Twitter. And those are really the three that we have access to. To access anything else, you really have to hire a vendor or an ad agency to really do that for you.
Thanks. And that brings up another thing too, of like you, when you're going out to the community, like you can do these community events, but thinking about who comes to those, but going to things like the library or other like community level resources that were all different people in the community might be at, versus just like people that are more likely to maybe attend certain events. So a variety of events, maybe non-health related community events as well as health events, so that you're getting all different members, not those that maybe are proactive and like, oh, I want to know more about prevention. they might not be the ones that you necessarily need to reach. So, and they might have a different viewpoint. So trying to get those different viewpoints for sure is really helpful. So you can use those events for recruitment as well as, collection of data, and even doing some snowballing where like you recruit and then tell other people to then spread. So then it kind of goes from there. That's always helpful. Anyone else? I'd love to hear. We have Doreen.
Good morning. In Queen Anne's County, we started a community mapping assessment, and what we did here was we did like a community scan of different agencies and organizations that are already like probably on, our drug-free coalition and different things we meet with. And I actually created some questions, and like it was like 8 questions to get information, like, what their mission was and their vision, and, how could other community organizations or agencies support what they're doing, and also for them to refer or recommend other organizations that we could reach out to. And I think the first step we did, we contacted like 6 different organizations that we were not like really a part of. And from that, we got a list of like other organizations that we had not reached out to. And it was like over like 20 or 30 in the community, like nonprofit organizations, like different organizations that are serving like youth, serving the community. And based on that, our next step, I presented it to our evaluator so we could, reach out to them to see what it is that we can do collaboratively to work together to address the issues that we have in the community. And like, what are the issues? What are you seeing? So this is like a first step for our community, assessment.
Mhm.
And a lot of people were really, really, engaged. A lot of the different people that I contacted was like key people, like the local management board, and then he was referring me to other organizations. And we even had like the Rotary Club, and they referred us to like other organizations. So basically, by the end of like the year or two, we're going to have a great group of collaborators coming together. So that's what we're doing so far.
That sounds great. And then also with that, that list is, then you have even all those different groups to help with recruitment of focus groups and surveys, because you can help leverage them not only for resources, but also for reaching different members of the community.
Yeah, that's correct. And actually, while I'm on this meeting right now, I'm steady getting like text messages, because one of the things that our prevention services have done, we were working with like one of the churches, and they do every month, they do like a food giveaway, and they take it to the elderly. They, have people coming up. So each month that they do it, like our health department, all of the different programs, they provide literature to put in the bags and to send to the, different people. Here we go. Send to the different people. And, it's just reaching. And then just like last night, another organization in the county, they're having a dinner today, and they're calling and asking for the information. So we're really we're being creative, getting out and, the information out even through, COVID. So, and, they're just coming together.
Great. Thank you for those tips. All right, I think we'll move on to the next slide. So this basically, we are going to be providing you as a follow-up to the slides, also some guidance for the needs assessment, putting together a toolkit. And a few of the components of the toolkit is sort of like a needs assessment outline template. Not to say that you have to create a formal assessment, but it might be helpful to sort of organize the data that you collect and assess. So that will include like sort of the different sections, right, of the data categories that we went over. So you have your consumption data, consequence, population, intervening variables, the community resources, and community readiness, and sort of organizing that all together into, that living document. Like we said, it's needs assessment is ongoing. So if you have something from before, you can always update it. But then also asking some of those questions really to assess, the magnitude, the trends, and really like the capacity, the readiness within each of those to really then determine where you would want to focus when it comes to which related problem or outcomes, as well as what are the underlying factors that are most relevant to impacting your the problems you've identified in your community. And the other thing is this really good tool is this PTCC checklist for identifying data gaps. This will be really helpful for you to kind of go through and sort of take notes and see. It lists tons of different data sources for each different data indicator for you to see, do we have data on this data indicator? And if not, and then identifying what you might need to collect and what might be helpful as you're moving forward, especially those that are doing the community-based process. Like Vanessa shared, we will also be including the community readiness survey and protocol that we had shared with you in previous years for those that have gone through the formal needs assessment process. That is a simple interview survey that you would send to different stakeholders, and then there's a protocol on how to score that to really determine the level of community readiness in your jurisdiction. And then we have some tips on developing surveys and interview guides that just as you're planning. But like we said, always reach out as you're putting stuff together, and we can help set up times to really provide you with samples that previous jurisdictions maybe have done, or definitely reach out to each other. You know, you all have the listserv. This is always a tip or reminder that you can all email each other and hey, has anyone have a current focus group protocol questions? Can you share them so that we have some of that stuff, but obviously you guys have that as well, so you can reach out to each other to see what other jurisdictions have created, and maybe you can adapt. Like we said, there's no need to always recreate surveys or interview guides, since we're all sort of collecting the similar information. So we'll be sending that out with the slides for you guys after this call. So next slide. That's it. We just have any other questions. If you want anything from before, what is overview of assessment, and anything else that you guys have questions for us, anyone on our team, or if you have questions for any specific jurisdiction and want to ask them now. If there's anything.
I have an easy question.
Sure.
I think. You were talking a bit about using QR codes. And the last time I quit using them myself because I had to pay for them. It was a service. Or is that not a paid service anymore? Is there a way to do free QR codes?
So a lot of the survey tools they can create the QR code for, so if you use SurveyMonkey or like Qualtrics or some of those other online surveys, you know, they have it that you can disseminate and they'll create a QR code. There are free QR code sites. There are one that you can create, and we can add that to tips on where to find QR codes and how to do that.
Okay.
Yeah, like Vanessa mentioned, there is also, for some reason my Google Chrome is being really weird. It's not letting me, even when I keep on opening tabs, to be able to share it. But if you're also on like Google Chrome, there's a share feature that you can share any site as a QR code.
Okay. Thanks.
Oh, there it is. Yeah, so there's a little share button, and it has QR. You can copy link, send to your device, QR code. You can share it directly to then any social media site. So that's why it is. You said the QR code right in it, but now they added even more options. So, but yeah, QR codes definitely are a way to reach a lot of different people. So, all right, so we can go to the next, if there's no other questions, we can go to the next slide, which is just the end. But before you go, we do have a quick survey that we'll throw in the chat, but we'll also send it out after. Vanessa, can you dump that into the chat, the link? There we go. Thank you. And then just on this slide, just as a reminder that Vanessa has added on the central county, so she also can do she will be the main lead for Baltimore County, Baltimore City, Cecil, Hartford, and Howard when it comes to TA questions. And if you want to set up any calls to get those calls set up with her. But if you have any general questions, definitely you can also reach out to our BERT email. Dr. Taylor, you can reach out to as well. Check out our website. We have some of the old previous guidance documents and such that are all available there, and this stuff will soon be added. And yeah, so definitely if you have any questions or need additional setup TA sessions with us, reach out. So we're at any other questions. Thank you all for attending. Hopefully it's a good refresher, some new info for those that have learned about assessment before, maybe, and for those that haven't really had an assessment training, you were able to get a better understanding of why needs assessment is so important, and that the data is so key to the SWIFT process. It's a data-driven process, and so data is very important to us within all of our grants. So yeah, that's it. Everyone have happy holidays. So thank you.
Happy holidays, everyone. Take care. Thank you all for the work that you do.
Thanks for all your help.
Thank you, everyone.
Welcome.
Happy holidays, everyone.
Happy holidays.
Happy
Bye.
holidays.
Hey, Nicole, did you say who is our new TA for Cecil? I couldn't hear. Sorry.
Oh, Vanessa will be the lead, so you can reach out
Vanessa,
to
okay.
you can always reach out to myself and the email, and that way someone will get back to you.
Okay, I just want to make sure I let Virgil know. Okay, thanks. Appreciate it. All right, take
Happy
care.
holidays, everyone, and thanks for everything.
Same to
Thank
you.
you. Same to you.
Happy holidays.
I guess I could stop the recording, couldn't I?